Good afternoon, everyone. My name is Tracy Mitchell, and I'm filling in today for my colleague Tracy Washington Enger as the moderator. I work at the Environmental Protection Agency in Washington, D.C., and I'm a certified asthma educator. On behalf of the US EPA, I'm pleased to welcome you, and we're pleased to host you today for an important and exciting webinar presentation. As one of the developers of the science that proves the link between asthma and environmental exposures, EPA has been a committed champion for expanding delivery and sustainability of in-home asthma care. We're so pleased to be able to offer today's webinar to hear from innovators in the field who have found solutions to ensure that children who most need in-home environmental asthma care receive it. We're eager to learn from, to support, and to shine a spotlight on our partners' stories that can teach us all so much about how to convince critical partners that improved asthma care is possible and how to move whole systems to bring the best care to the people, particularly children who need it most. Thank you for joining this important discussion today. If you've participated in previous EPA webinars, you know that our question and answer period will take place on the discussion forum on AsthmaCommunityNetwork.org immediately following the presentation. So from 3 to 3:30 p.m., please join us to interact and ask questions of our speakers. To see the discussion forum directly now, you should be receiving a link via our chat feature, and you can click on that link to be able to access the discussion forum. To ask questions, you can do that during our presentation. You can type it into the discussion forum, but you first must be a member of Asthma Community Network. So if you're not already a member, please take a moment to do so. It's a very simple and quick process, and we'd really hate for you to miss out on interacting with our presenters after the webinar. As with all of our webinars, this webinar will be archived on AsthmaCommunityNetwork.org, as well as you'll have access to the question and answers. If you're unable to join us, you'll be able to access the discussion forum at a later date. Before we dive into the presentations, we always like to get a sense of who's in our audience. So if you would please take our first polling question and let us know what type of organization you represent. The poll is open now, so please click on which organization or agency you represent. Perfect. So it looks like almost half of us are federal, state, or local agency or government employees. We've got a nice representation of community asthma programs, and then a pretty large representation of those who classify as other. So I'd be curious to know what organizations you're from. Unfortunately, we don't have the ability to ask that specific question, so maybe you can let us know that in the evaluation or in the question and answer portion later. So our learning objectives. On today's webinar, we feature Amanda Reddy, Executive Director of the National Center for Healthy Housing, NCHH, and Robert Curry. Bob is of the City of Dallas in Texas. Amanda and NCHH have been a cooperative partner of EPA, providing technical assistance to communities across the country looking for sustainable funding for asthma in-home interventions. One of the communities they've worked with is the City of Dallas, and in its efforts to enact proactive housing code inspection and enforcement strategies that will improve asthma and other health outcomes. Today, we'll hear about the experiences in Dallas and focus on the connection between housing codes, asthma, and health outcomes. So in today's webinar, you'll learn about communities, including Dallas, but a couple of others as well, that have focused on infrastructure and other housing code strategies to positively impact children with asthma. You'll learn about the National Health Housing Standard and how it can be used in housing codes to improve asthma outcomes. You'll also learn about NCHH's experience providing technical assistance and coaching to communities working to promote access to in-home asthma intervention. So with that, we have our next polling question. Based on the learning objectives I've just outlined, would you please let us know what you're most interested in learning about today? Great. So we have about 40% are interested in housing code inspections and enforcement strategies, and about an equal number interested in promoting access to in-home interventions. I think you'll walk away from today's presentation with a lot of useful information regarding all of these components, and so I'm very excited to get started. Before we dive into our presentation from our expert speakers, I'd like to just take a moment to set the stage. First, I'll provide a very brief background on EPA's asthma program, and I'll talk about EPA's efforts to make sure that community-based programs are delivering asthma care and are doing it comprehensively and including in-home interventions. Also, EPA is helping programs with sustainability, focusing on how those programs are reimbursed and funded. This means looking at building capacity and systems change. Amanda and NCHH will share their experience and expertise and the evidence around health outcomes, especially as it pertains to asthma and sustainable financing. Then Bob will emphasize the importance of partnerships. You don't have to be an expert on financing to be able to do this work. Bob will share how he brought his experience in infrastructure and his ability to reach out to others in the community and build partnerships. For Dallas, asthma is the lens that drove the first wave of change in housing codes, and we feel that this is worth modeling and could serve as an alternative to other financing models, and we're so pleased to be able to explore the possibilities today with you. So I think all of us, if you've worked in asthma, you know the burden of asthma. You know it's a public health challenge characterized by disparities. You also know we've made great progress. CDC reports that some national indicators are improving. Asthma prevalence among children has decreased slightly. Asthma attacks have decreased in children of all races and ethnicities, so this is good news. Asthma-related hospitalizations and missed school days are fewer when we compare 2013 to 2003. And in that same 10-year period, utilization of asthma action plans has increased. So this is all good news. But we know that disparities continue. Children living below the poverty line experience the most emergency department visits, the most missed school days, and the most hospitalizations. These high utilizers with uncontrolled asthma drive up costs. So we know that asthma is an expensive disease. It costs the United States over $50 billion, that's with a B, dollars each year, and Medicaid spends more than $10 billion each year to treat asthma in children and adults. But we also know that asthma is a treatable and manageable condition. Science informs policy and forms the foundation for EPA's program approaches. Science tells us that along with medical management, there's a strong evidence base and supporting national guidelines that recognize the role of environmental triggers and their remediation as an important part of comprehensive asthma management. We know that eliminating common indoor triggers like tobacco smoke, pet dander, molds, cockroaches, and dust mites results in decreased symptoms and asthma episodes and improved outcomes for people with asthma. We also know home visits are a critical component. Particularly, home visits are important for these at-risk populations. Families are often in crisis mode and facing many issues, and home visits provide one-on-one time that families need to help their child gain control over asthma and to help with education and remediation about triggers. As technical experts in the built environment and health, EPA has led the federal effort through non-regulatory strategies that enable communities to deliver and sustain in-home environmental asthma care aimed at ensuring access. So EPA is making unique contributions to this work. Through the 5 program components represented on this graphic, EPA is meeting communities where they are. So I'll quickly just go through these 5 components. EPA hosts learning spaces to share, learn, and connect through AsthmaCommunityNetwork.org, as well as other national media campaigns. EPA provides technical assistance through cooperative agreements and partnerships, such as the partnership with NCHH, as we're highlighting on today's webinar. EPA recognizes and leverages excellence through our National Environmental Leadership Award in asthma management. And I'll quickly plug that we'll be launching the 2019 competition very soon, so please be on the lookout for that announcement. EPA advances national policy through collaboration with the Asthma Disparities Working Group and our other federal partners, and we advance the policy locally through regional asthma summits. And EPA synthesizes and spreads learning through the community of practice. Partnerships across health, housing, and environmental sectors is an essential lead to success when delivering in-home asthma management. By identifying best practices and successful programs like those who are with us today, we strive to synthesize and spread the learning in order to increase savings, expand the healthcare workforce, and reduce healthcare costs. Through organizations like NCHH, we're also providing the technical assistance and resources for community programs and health payers who are undertaking these efforts. So now I'd like to turn it over to Amanda Reddy from NCHH for more about this important work.
Great. Thank you so much, Tracy. And thank you to all of you for joining today's webinar. Before we dive into the role that housing codes and code enforcement can play in improving asthma outcomes, it may be worthwhile to just take a step back and set the context for why and how housing matters and for health and how it can be part of the solution. We know that for many of you, that is old information and old news, but we also know that this is a topic that's a little bit different than some of the webinars that have been offered through Asthma Community Network before, and you may be newer to the topic and the conversation. So one of the reasons that housing matters is that as Americans, we spend a lot of time at our home. The National Human Activity Patterns Survey estimates that on average, we spend about 70% of our time not just indoors, but in our home environments. And that number can be even greater for certain vulnerable populations like the very young, the elderly, the disabled. So it's very clear that the home environment is a pretty critical setting when we're talking about setting the stage for people to have good health. It's also important, though, to not just understand that the home environment is important and that housing matters, but understanding that there are a variety of ways that housing matters. So we know from decades of research that housing affects health through multiple pathways. The location of housing and the physical neighborhood attributes surrounding the house, the house or the residence, how walkable the community is around it, whether there's proximity to traffic and other pollution sources, the outdoor air quality, access to public transportation, parks, schools, and employment opportunities, all of that can affect a person's health. We know that affordability is another important dimension of health and housing, that unaffordable housing can really not only make it difficult for families to stay in housing and contribute to residential instability, to crowding, but it can also force a household to make trade-offs between different types of costs. For instance, the money that's available for nutritious food and necessary healthcare expenses like asthma medications, for instance. We also know that the demographics or the social and community context around a community, the social cohesion of a neighborhood, and other factors can be really important for health. At the National Center for Healthy Housing, however, the dimension of housing that we are most interested in and that we focus on is about housing quality. And we know that housing quality can impact health through also a variety of pathways. It can impact your physical health, your psychological health, as well as your safety. Digging a little bit deeper into how housing quality affects health, there are a variety of different chemical, biological, and physical exposures that can occur in the home environment. This is by no means a comprehensive list here, but you can see chemical exposures like lead and radon may be present in homes either from naturally occurring sources such as radon or from the existence of chemicals that were brought into homes, for instance, through lead paint. Through biological pathways like molds, dander from pets or pests like cockroaches and mice, or if the physical condition of the home, if there are structural issues with the home that may contribute to various health outcomes. And the list of health and housing outcomes and conditions that can arise from housing conditions is quite numerous. We know that disparities in housing quality can exacerbate disparities in a variety of health conditions, including asthma, and the disparities that Tracy mentioned in her opening remarks. Housing that is full of mold or cockroaches can make it really impossible for a person to control their asthma, even if they're doing everything else right. So we know that asthma and allergy, other respiratory conditions are really, really connected to health. A variety of other housing conditions may be impacted. And it's important for you to know, even if you're somebody who focuses exclusively on asthma, we know that that is true for many of you in this audience. And for instance, as you're making the case to other partners or funders, investors in your work, sometimes it's helpful to say, we really care about asthma. We know we can make an impact on asthma by doing these interventions. But you should also know that by doing these things, we're going to affect all of these other endpoints as well. So housing conditions can also impact lead poisoning, falls and injury prevention, fire injuries, cancer, cardiovascular events. You can see the entire list here. I want to also point out mental health outcomes and quality of life outcomes like school attendance, the ability to go to work, caregiver quality of life are also highly linked to housing conditions. So we know it's a problem. The natural question is, what can we do about it? And it turns out that this is a really important question to ask. The Frameworks Institute a couple of years ago conducted some social science research to understand what sort of the general public understanding of the term healthy housing meant, and sort of to map the gap between what expert opinion is and the general public's understanding of that term. And one of the really interesting findings to me that came out of this report, and you see the link here on your screen, is that in general, people do understand that there's a connection between housing and health. And those of us who are in the field, particularly those of us like myself who have a scientific background, we spend a lot of our time messaging around that problem, that connection, trying to convince people that there is the connection. It turns out people kind of get that already, and they don't need a lot of help understanding that. They may not know all the specifics, but the underlying concept is pretty solid. What we have found out through reports like this is one of the challenges is that people understand it's a problem, but they think, there's nothing that can be done about it. It's just such a big problem. It's going to cost too much money to solve. It's just, they're greedy landlords. Nobody can do anything about it. They have this fatalistic attitude about what the solutions are. And a lot of the ways that we go about our messaging can inadvertently sort of trigger that concept in their mind, this sort of fatalistic attitude. And that's important for us to know, I think, as we think about how we approach potential partners, funders, investors in our communities, so that we can really be sharp with our messaging and solution focused and not accidentally sort of trigger that fatalistic attitude. Because it turns out there is a lot we can do about it. The slide that you see in front of yourself right now comes from the Environmental Health Playbook. This was put together by the National Environmental Health Partnership Council. And the items that you see in the darker blue there are critical elements of what the National Environmental Health Partnership Council articulated as components of a well-functioning, high-functioning, effective environmental health system in a community. And then the items that are in that gray or lighter blue are some of the specific housing strategies that were developed as part of this group's attempts to articulate where we should be putting our priority and our emphasis in terms of improving housing quality to improve housing and health. And so you can see some of these buckets of collecting and tracking information, having a well-trained workforce, sustainable funding, having evidence-based policy and programs, the partnerships, equitable access. These should all be familiar terms to many of you who've been involved in the Asthma Community Network. It's a very similar framework. I don't want you to focus on all of the details on this slide. What I'd like you to just point out is that those items that are highlighted now in orange on your screen all relate to housing code and code enforcement. So across all of these different dimensions and all of the different ways, we talked about all of the different pathways for how housing can affect health, not just through housing quality, but all of those different dimensions. Look how many of these strategies relate to code and code enforcement. So let's take a minute just to think about why housing codes show up so often as an opportunity to improve population health, and for asthma in particular. First of all, we know not just from experience and from logic, but also from studies like the one you see on your screen, Beck et al. For 2014 out of Cincinnati, that in places where there are higher numbers of housing code violations, that those places tend to co-occur with places where the burden of asthma is high. Here we see the density of asthma-related housing code violations, those are those black dots, overlaid with asthma-related ED visits at the census tract level. Those are the areas with red and purple are areas with higher rates of asthma-related hospitalizations and ED visits. So we know that there's this natural connection, that there seems to be an association here. But the other reason that code enforcement, I think that EPA was interested in presenting this topic to you, and especially for those of you who are used to coming on and hearing about how do we build sustainable financing, how do we approach the healthcare sector and increase their partnership with an investment in home-based asthma services, is that code enforcement is one example of how you can sort of build the infrastructure in a community that can either be a complement to healthcare financing of home-based asthma services, or in communities where the healthcare financing or other types of financing isn't in place yet, it can be an alternative to that. So it can, when it's serving as a complement to existing financing or funding that's in a community, it can help expand the number of people that are receiving necessary services. It can help expand the scope of services that are provided by addressing issues that maybe a healthcare funder or partner is not able to address. It can also help provide, as we see on the slide, some needed data to help make the case and to help funders really feel like there's a good infrastructure in a community. Often in my experience, when I've spoken to healthcare funders or payers, one of the things that they really say is they want to have a plug-and-play infrastructure. They want to be able to not build a program from scratch, but know they're entering a community where there are robust resources. And a high-functioning code enforcement system can certainly be a key part of that. I'm going to spend a little bit of time on this next slide. So I just want you to know it's not that your webinar froze. I'm just going to spend some time here. So that's by design. To talk a little bit about how codes can be part of the solution. And I want to highlight this report that comes out of Change Lab Solutions, another partner who's done some really great work in this area. NCHH was one of the contributors to the report that you see the link to at the bottom of your screen, describing some of the steps that can go into making an effective code enforcement program. And for those of you who might think, we have code enforcement in our community, it's already set up, we don't have to listen to any of this, we've got this covered, these are probably just already, just check the box. What I'd like to do is just walk through this and talk about the difference between just having these things in place and really doing them effectively so you can achieve maximum impact to have that public health impact and reduce those disparities. So starting with number one, the obvious thing is that at the start of this, you need to have a strong housing code that you can be working from. And one of the things to know here is that housing code, that as it exists in many communities across the country, often uses a lot of really ambiguous phrases. So it'll use phrases like safe or healthy or decent housing that aren't really, really well defined. And that leaves a lot up to the discretion of individual code enforcement officers or communities in terms of how it's applied. Many housing codes also don't properly address health-related threats in the homes like pests, moisture, ventilation, or chemicals like lead and radon. So there's certainly an opportunity to take a critical look at your housing code and see if it can be strengthened. That's a really excellent first step as it serves as the foundation for everything else that follows. Obviously, you need to have adequate funding to have a code enforcement system in place, and that state and local law may govern what's possible in this area, but some very common sources for funding code enforcement work can be a general fund at the municipal level. Some communities have been able to leverage Community Development Block Grant or CDBG funding to help support their code enforcement activities. Other typical methods of raising money for code enforcement can come through permitting or licensing fees, and sometimes through fines and penalties that are levied for housing code violations. But it's really important to make sure that it's well-resourced. Otherwise, it's certainly not going to be effective. Having a well-trained workforce and training your officers is really, really important. And while it may be obvious that all of the code enforcement staff need to be trained in all of the applicable federal, state, and local laws, it's also, I'd like to remind people, that it's important to, first of all, train the wider team that may be involved, not just the folks that are going out into the field, but all of the folks back at the office that may be supporting them or interacting with residents or property owners throughout the process. And to also make sure that they're equipped with best practices and some of the softer skills. How do you work with landlords and tenants? These are really emotional and challenging issues in some cases that we are dealing with. So really equipping your code enforcement officers, not just to know what the rule is, but how they can effectively work with people to achieve resolution, how they can find resources to help residents, is going to take your program from, just being in existence, sort of checking a box, yeah, we have it, to actually being effective and having maximum impact. Partnerships we'll hear more about from Bob, as Tracy mentioned, but we cannot be emphasized enough that having these partnerships both within the community and across agencies within a community, this is number 4 and 5 on the list here, very, very important. Community-based organizations, if you work with them, can help to, or if you are a community-based organization, what your role can be is that you can help to educate residents, both landlords and tenants, about their rights and responsibilities, about what the process is supposed to look like for code inspections and enforcement. And you can also provide some needed supplementary services. So referrals, connections to mental health and social service programs that are often needed when you enter a residence, help with language and cultural barriers, and sometimes even connections to resources that can help with repairs. Maybe a property owner really wants to do the right thing, but they have some challenges in making those repairs. And those cross-agency partnerships can also really help there. The responsibilities for code enforcement sometimes be spread across multiple agencies, which can make the process a little bit confusing for tenants or lead to duplication of efforts, or even worse than duplication of efforts, I would say, is nobody taking responsibility, everybody assuming that another agency has that covered. So it's really important to have that cross-sector, cross-agency collaboration. A great example of this that I like to offer is at the Erie County Department of Health in Erie County, New York. The inspectors for their Healthy Homes programs that include asthma components as well as their lead programs at the local health department, the county health department, have been deputized as code enforcement officers. So when they're in the home already doing inspections for lead, for asthma, for Healthy Homes, they can actually write the citations and initiate the code enforcement procedure there. They don't have to go back and send out a code enforcement officer for a separate visit. And that really helps to streamline the process for everyone. That brings us to number 6, developing a cooperative compliance model. And this is really about transforming the traditional us versus them dynamic that can exist in code enforcement transactions and equipping your code enforcement team with tools for how to work with and really support property owners throughout the process, from why it's important to how it can be fixed and how they can get connected to resources, and certainly enforcement too if it's needed. The beauty of a cooperative compliance model is if it's done well and effectively, and as it becomes embedded in a community over time, your reliance on enforcement mechanisms may have to lessen because people are not only incentivized but supported in doing the right thing. Enforcement is always going to be important, though, and that's why number 7 is about enforcing the local code here. There are 3 main categories of enforcement. The most common is administrative action. So this includes actions like written notices, fines, departmental hearings, putting a lien on a property, et cetera. Sometimes things are escalated to civil action. This is working through the court system to, for instance, compel a property owner to make repairs or pay fine or damages for a violation. And then in fewer cases, but in some states actually do allow for criminal charges to be filed for some types of violations, usually as a misdemeanor or an infraction. It's worth noting that court options are more costly and are usually used as a last resort. So those administrative actions are where most communities actually see the process working. When we get to number 8, we're really talking about model communities here who have really taken a step and not just have a really robust sort of standard code enforcement system, but are working to actually get ahead of the problem. So proactive rental inspection program is is one way to do this. Traditional code systems are complaint-based. They wait for a tenant or a neighbor, somebody in the community to call and say, I think there's something going on at this property, please come check it out. Under a proactive rental inspection program, all of the units are inspected on a periodic basis. So this doesn't replace the complaint-based system. Certainly if something comes up, the complaint-based system is working side by side, but a proactive rental inspection system can help renters, undocumented residents, others who may be unaware of their rights or afraid to exercise them, really access their right to safe and healthy housing. And it has three major components: a registration process. This may be like a certificate or a license for occupancy. Periodic inspections. These can happen every few years. It varies from community to community, maybe every 2 years or 3 years or 5 years. And then enforcement for those who fail to meet the standards that are set out there. Number 9, if you have all of these things in place, is to put in place supplementary programs. And again, this is related to some of those earlier points about really making sure that residents, the code enforcement officers, everybody is supported through the process, that we really make it easy and possible for people to do the right thing. So making sure there are educational programs in place so that people know their rights and responsibilities, the process, and that there are resources to subsidize or pay for repairs, to provide relocation assistance if that's needed, et cetera. And then number 10 is about evaluating the code enforcement program. And I'm an epidemiologist by training, so I love this part of it. And it's really important to help monitor the functioning, to know what's working, where you can improve, but also to justify resources, right? You can have a model system in place and it's running, but something in your political landscape changes. The champion a person who put this in place and was a champion for it every day decides to retire, and you don't want it to fall apart. So it's really important that you always have on hand the data to talk about why your system is working and having impact and is important to continue. So I'll just say a few words then about also some of the tools that are available to help get you started on some of those early steps. So the first step was about establishing a strong local housing code. In 2014, the American Public Health Association and NCHH, together with a large panel of experts, published a set of performance standards for existing housing called the National Healthy Housing Standard. What this is really about is bringing public health rationale into building code parlance, bridging that gap, and creating a set of model codes that communities could adopt to make their housing codes more protective of health. And it's comprised of a set of core and stretch provisions in different categories. There's a link to the tool there available online. And over the years, we have worked with a number of communities to put this tool into action. And one of the things that can be a really easy first step is to take the National Healthy Housing Standard and compare it to your local code. So here's a sample sort of visualization of what can happen if you go through that process. You can compare a local code here that's shown for this Anywhere USA and by the blue bars. Compare that to the International Property Maintenance Code, the IPMC. That is a very common code that is adopted in part or in whole by many communities. That's shown by the red dotted line here. Compared to, again, then the core provisions of the National Healthy Housing Standard, shown by that purple line, and then the stretch provisions. That's sort of the best gold standard of the National Healthy Housing Standard. That's that green line at the top here. And this kind of visualization makes it really easy to see, where is your community strongest? Where is there opportunity for improvement? We had done this comparison in about 25 different jurisdictions. Many of those codes, these visualizations and the results of that are published online and given them not only customized recommendations of where they can improve, where they're strong, but because we have the standard that I showed on the previous slide, there's a model code they can adopt if they decide that they want to take on moisture and pest management. There are codes that they can go and just adopt without having to create that. And we've seen this lead to change in at least 2 communities. There are 2 case studies published on this in the city of Tukwila Back in 2015, the Tukwila City Council, this is in the state of Washington, adopted an ordinance that incorporated the National Healthy Housing Standard wholesale within their local property maintenance code. And I'm about to turn it over to Bob in a few minutes from Dallas, who's going to talk about the process that they used to not only update their housing code using the National Healthy Housing Standard as a guide to really focus on some of the issues that are very relevant for respiratory conditions like pests and moisture and excessive temperatures, but how they also took that opportunity to put in a proactive rental inspection program at the same time. Before I hand it over to Bob, I just want to acknowledge that there are some common challenges that we see associated with this work, that there can be sometimes a lack of data that's available. We've already talked about some of the financing challenges that many code enforcement offices are under-resourced already, so asking them to do more can sometimes be a challenge. One of the ways we can get around that is, again, through that partnership and that cross-agency collaboration. Again, I love that example from Erie County about deputizing folks and that already may be going into homes so that they can help with that work. Poor enforcement mechanisms is a challenge in many communities that they either don't exist or are not applied evenly or well. So that's certainly an area of work that needs to be addressed in many communities. There's a lot of concern frequently when people want to take this on about the fear of opposition or perceived costs of improving housing quality, that you're going to get a lot of pushback from folks in the community or have a lot of unintended consequences as a result of putting this in place, that we don't want to affect, for instance, the supply of affordable housing in a community. These are all real challenges, but because they're real challenges, that means others have struggled with them as well. And that as a result, there are tools to help. So as Tracy mentioned at the beginning, there are a number of organizations, not just NCHH, but many who are available to help connect you to those communities and learn from their stories so that you can overcome those challenges, as well as to tools that have been published to help you dig into these problems. I want to highlight particularly Change Lab Solutions. You see a number of their resources highlighted on the screen here. They have some excellent resources in this area. At the National Center for Healthy Housing, we also host an entire page related to housing code tools. And before I hand it over, the last tool that I'll mention for something that may be released this month, it's coming soon, is that are for communities that are interested in doing that comparison, taking that first step of comparing their local code to the National Healthy Housing Standard. We decided we didn't want to be the thing that stood in their way, that we didn't want to have to wait for us to get more funding to help communities do that. We wanted to make it easy for anybody within a community to be able to do that kind of comparison. So we've put together an online tool called our Code Comparison Tool that we like to think of as TurboTax for housing codes. So it's a very easy to access tool. It tells you how to find your housing codes, what to look for, and then there's lots of tools and hints throughout. You're guided through question by question to rate your housing code, and then a customized report with a visualization is generated for you, referencing where in the National Healthy Housing Standard you can go to find support for strengthening your housing code. So I'm sure there's lots more to talk about here, but I want to make sure that we have adequate time to hear Bob's story, so I'll turn it over to Bob.
Well, thanks, Amanda. I'm always refreshed when you give that presentation, because I always learn it all over again. And you're quite eloquent in how you talk about it. I work for the city of Dallas. I work in the neighborhood code compliance section of our city. I do special projects, and one of those over the last several years has been the change in our minimum housing standards. There are two different codes that we differentiate between. Many of you are probably familiar with building codes. These are the ones that regulate predominantly new construction and major remodeling. These are the ones you have to go down to the city or your jurisdiction and get a permit. It regulates all aspects of the construction. Even though and these are put out primarily by the International Code Council, and they're adopted by jurisdictions, sometimes modified when they're adopted, but that's where they come from, and they're based on experience of what happens to structures over time. So if you have, say, a fire that's caused by an electrical situation, That'll get studied, it'll get evaluated, and see if there needs to be change in the codes themselves. One example of that, a number of years ago, we used to use a lot of aluminum in wiring in houses and found out that the incidence of fire in those structures was greater than that. They used copper. They had to change the code ordinance regarding that particular technical aspect. The maintenance codes are different. And while the Code Council has developed the International Property Maintenance Code, as Amanda has talked about, it isn't necessarily the gold standard. It's pretty good, and if you have nothing else, certainly start with it. But the maintenance code does exactly that. What happens common sense tells you, if you're building something, it ages and over time. It'll get, the components will deteriorate. They need to be replaced. If you own a property or in your life, you know that you have to budget $200-300 a month over 20 years to make everything stay reasonably safe and sound. So the deterioration of structure is the big one. Plumbing leaks happen. That brings on the whole situation with mold that we know so much about and how it ties in with asthma. Insect infestation. Very few houses, especially the older ones, are sealed in a way to keep bugs in or out. So we tend to see them. Especially you get down here in warmer climates, you tend to have ants at certain times of the year. Up north, maybe it's more termites, but insects are an infestation wherever we are, and we've adopted things in our code here to really deal with that. When we started this, we did it from a non-health perspective, quite frankly. We looked at the problems we were having enforcing codes on structures and found out that our codes were hard to understand. If any of you ever read a city ordinance, you'll know what I'm talking about. It's like written in a language not known on this planet, and then we expect people to obey it, and they can't even understand it. So what we did was we looked at the common problems we have in enforcement, and then we looked at the code, compared it with the International Property Maintenance Code to see how we could make improvements. So the key in IPMC, International Property Maintenance Code, if we're going to use that, fine. Personalize it to your part of the country and your jurisdiction. So Dallas started doing the physical part of the property maintenance code, just with definitions, clearing up a lot of mischief in the code, that sort of thing. But coincidentally, about the same time, the Children's Hospital here created a Health and Wellness Alliance in 2013. It was really cross-collaborative. It was people from EPA, people from the American Public Health Association, others that had an interest in the health of children, because what the Children's Health Hospital noticed was a spike in asthma admissions back in 2012-13, and they did some research on it and found out what Amanda has really brought to our attention. You tend to have more asthma where you have people that are poorer. There's a lot of the affordable housing in Dallas, and I think around the country, tends to be older pieces of property that maybe aren't maintained as well. So they knew they had a problem, and they wanted to figure out how to address that particular issue, because we found, as I'll point out in another slide, the tremendous cost and impact on the city of that. Amanda mentioned it nationally, but we can drill it down into our community. So through this alliance, the City of Dallas Code Compliance, where I work, and the Community Prosecution Division of the City Attorney's Office, they're really a community-based component of the City Attorney, began working in 2014 to look at how we could do the job better. And it's a huge project. If you want to keep yourself busy for a year or two, take on that task. We did, it took 2 years, starting in roughly 2014, passed it in 2015, 2016, we did council briefings and stakeholder meetings in quite a number, and passed the ordinance in September 2016, and went into effect just last year. We had many partners in this. This is just an overview. In the upper right, you'll see the Environmental Protection Agency Region 6 here has been a persistent supporter in bringing more healthfulness into our area. We partnered early on through the Health Alliance. They said, you really need to talk to this National Center for Healthy Housing. They're doing this new comparison tool that Amanda described to you, and maybe they can help you out. And we sure enough got on the phone, exchanged documents, and they looked at our early code. I think we scored around 30% out of 100 on our standards compared to theirs. We involved the apartment association because Dallas has 40% of its population lives in apartments here. That's higher than many places around the country, so we had to recognize that. Similarly, we knew from census data that about 20% of our population lives in a single family or condo unit, which you had to do the math. You got 60% of our population living in rental property. That's pretty high compared to other places. So there were some other organizations that got involved early on. The Dallas Area Interfaith, which is part of a nationwide movement, but they have a representative on the ground here, and they represented a group of apartments in one part of the city that are predominantly occupied by Latino or Spanish-speaking people. That was partnered with a local synagogue and the Unitarian Church, and they formed a real powerful voice for tenants there. Along with that was the Texas Tenants Union, say that 25 times fast, and they really had a very strong voice on things that they thought needed to be done. So it was very collaborative. The city of Dallas, several different departments, building inspection and code compliance, the tenants, the EPA, national organizations, Center for Community Progress that Amanda mentioned, and we all brought them together to put energy into this. That process was thorough, quite extensive. We knew that we had a big problem. We had been studying the issue of urban blight like many cities have done, and when this asthma thing came forward, the Children's Alliance documented that about 60,000 people, young people in the city of Dallas, were being affected by asthma at a cost of $60 million, mostly coming out of taxpayer funds. We don't have a state income tax here. It all comes out of property tax for the most part. And the majority of the property tax in Dallas isn't imposed by the city expenses. It's really schools and hospitals. And they documented, Children's documented the amount of emergency room trips per 1,000, and you can see it on the drawing there. The dark red diagrams, interestingly, correlate with some impoverished areas of the city. The one right in the middle is near just south of downtown. It's been negatively impacted from both a economic view and segregation issue for decades. So we knew we had a problem there. So in our working group with the Children's Hospital, we identified the things we thought needed to be changed. And one of the things that was brought up there, we looked at the things that we could change that would give the most impact with the least hassle. As Amanda had mentioned earlier, you can have pushback. You go into an apartment complex and tell them they got to rebuild it and watch the hair stand on the back of their neck. They don't want to do it. Almost any property owner doesn't want to spend more money than they need to. So we picked some fairly simple things. We used to have an ordinance here that enforced a maximum indoor temperature only a few weeks during the summer. We changed it to year-round. and we made it a uniform 85 degrees. We said, although we'd like to put in integrated pest management, that requires a lot of effort on the part of the tenants. But if we just changed a minor thing and said, if you're going to use pest control, it has to be done by a licensed operator, as opposed to simply specifying that it has to be done by approved technology, it makes it a little more tighter. And finally, we added provisions in there to address the sources of mold, which, as most of you know, is moisture. But putting together the code is fairly simple compared to getting it sold. And I'm a salesperson by background, so that's kind of how I look at it. We did over 30 community meetings throughout the city and brought people together. Typically, 30 to 70 people showed up at each one of those. We did 6 briefings, full briefings, formal briefings for the City Council Housing Committee. The council then required we did a full briefing to them, and they said we need to have a public hearing. We had like 400 people show up at the public meeting and made their voices heard. A lot of those were tenants. We met with individual council members, and we encouraged all the stakeholders as well to meet with them. So that was the selling process. Took about a year and a half. As I said, we went into effect on January 1st, and we're just starting to measure the health results. And we've also learned some things, hopefully. Identifying the possible landlords in single family takes time. We use council appraisal data. More recently, we're now using utility connection data. But when you don't have a program for people that identifies them as landlords, it's tough. So we had to kind of dig it out, and that's what we're still in the process of doing. Getting the word out to these people was more difficult than we expected, quite frankly. You kind of hope you put an article in the paper and people line up to register. Well, they don't do that. So we got the word out through social media and other things. As of this week, we have about 17,000 out of our expected 50,000 single-family owners registered. We found out the online registration is too complicated. We need to simplify it. We're in the process right now of doing that. We've inspected about 8,000 or 9,000 of the properties that have been registered. It requires additional training or use of third-party inspectors. We've done it with training so far, and we've begun to revise the ordinance to simplify it. It's been a very interesting process, not necessarily easy, but well worth doing. So that's the end of my presentation. We'll now get into the questions and answers.
Perfect. Great. Thank you both so much, Amanda and Bob. I'd just like to say, a couple of the takeaways. Amanda, I really love how you talked about code enforcement as being a complement to an existing financing system and being able to expand your scope of services or your scope of the numbers observed by using code enforcement. And then, Bob, you tell a great story. You have an impressive list of partners. And I think one of the takeaways for me was persistence. Definitely takes time and requires lots of buy-in. So I'd love to invite you both to come back. I think we could probably spend several more hours learning from you, talking about the new online comparison tool that NCHH has developed. And then, Bob, you're going to have, I'm pretty sure, some impressive outcomes to be able to report. So I'm hoping that maybe we'll hear from you on a future webinar. Thank you both. Before we close, we have just a minute to do our final polling question. We'd like to get a little bit of feedback from our participants. So based on what you heard today, what action are you most likely to pursue? Would you be accessing Asthma Community Network to learn more about housing codes and health? Will you be accessing NCHH's National Healthy Housing Standard and learning more about that? Will you be looking to connect with colleagues about building partnerships specifically around maybe housing codes or something else? So it looks pretty evenly split between learning more about housing codes and health on Asthma Community Network and about learning more about the National Healthy Housing Standard. it's great to see so many of you are interested in building partnerships and connecting with colleagues. As we've heard from both Amanda and Bob, that's really a key into being successful for this work. I'd like to thank all of you for your participation today, being a great audience, and I'd like to invite you now to join us at the question and answer session on AsthmaCommunityNetwork.org, the discussion forum. You see on your screen the directions for accessing Asthma Community Network and the discussion forum. And so we'll be signing off here and heading over to Asthma Community Network right now. That concludes our webinar. Thank you again.